about 2 minutes. Thanks for joining. Hello and welcome to today's webinar. It's called Bridging the Data Gap, 5 Tips from Building Data-Driven Organizations. We're going to be just beginning in just a second. We're joined today by Dr. Alan Berry and Carole Anderson. We'll just go over the agenda real quick. So today we're going to start with a welcome and introduction. We'll talk a little bit about the mission of the town of Greenwich. We'll talk about how Dr. Berry determined the problem that they were facing, and then he will give you some best practices about where you can start to change in your organization. He will also summarize the lessons learned, and again, during this entire presentation, you'll have the opportunity to submit questions both online through the webinar and through Twitter. If you'll please tweet and use #DataGap, again, that's #DataGap, sorry about that, to follow us on Twitter and to submit your questions. We will be doing live tweet during the webinar today. Following that, Dr. Berry's presentation, we will have a short presentation by Carole Anderson of ClientTrack. We will then address some questions and answers, and we will provide you with additional contact information to follow up with us after the webinar. So today we're joined by Dr. Alan Berry. He is the Commissioner of the Greenwich Department of Social Services. He has been there since 2010. He has over 25 years of healthcare administration experience, mainly in the behavioral health field. He, prior to joining the Department of Social Services, he served as an Associate Director for the Southwest Connecticut Mental Health System, where he directed the efforts to reorganize and consolidate the clinical and support programs of a large public sector multi-service delivery system. He has a master's degree in social work and a PhD in public policy and administration from the St. Louis University. We are very happy to have him here today. Thank you so much, Dr. Berry, for joining us.
Thanks for having me.
In addition, we have, sorry about that, we have Carole Anderson. Carole is a solutions engineer here at ClientTrack. She works with both prospective and current clients to craft the most efficient solution for their organization based on best practices and specific organizational goals. Carole has over 18 years experience in technical roles and multiple years working directly with health and human services organizations. She assists them with accurately representing the value of the program with data. Thank you, Carole. We're looking forward to having you with us today. Again, please ask questions via the webinar or via our Twitter with the #DataGap, and we'll be happily answering those questions both during and following our event. Dr. Berry, I'll go ahead and turn it over to you.
Okay. Well, thanks for having me. I'm hoping that the experiences we've had here will help others. What I wanted to start off with are the 5 tips, to go over them with just a brief summary, and then we'll follow up with a little more detail. The first is to find the right program fit for your organization, and that's really choosing the right software program that's right for your organization, right-sizing it. The second is to put your data to work and that's documenting the effectiveness of your efforts or your outcomes. The third is to resist knee-jerk changes. That's to use the program as is, as best you can, to better assess what your future needs and changes will be. The fourth is to provide support and maintenance for your program, and that really means that clean data will result in good information. So it's almost a garden concept. You have to, I'm not being too facetious here, but maintain your weeding and feeding of your software system. And I'll go into a little more detail on that. Lastly is to create service plans that consider data. Your service plan is the repository for all your client information and really documents your results. Can I get the next screen, please? Just wanted to go briefly what our mission statement is, because that's really important for your organization when you start off trying to assess what your data needs are going to be. So just our mission, as we established it a few years ago, is that we really see ourselves as enhancing the quality of life of people who live in Greenwich. And we do that really through support in meeting basic human needs. So we have clients who arrive at our door in an emergency, in a crisis, that usually has to do with basic needs around housing, food and clothing, personal safety, healthcare. So in other words, they can't pay their rent, they can't pay utility bills, they can't afford medical bills, they're having problems with domestic violence. So people are coming through our doors with immediate needs, and we have a variety of ways that we will help them to get through the emergency. But then the second part of it is, how do we go about working with that client to develop long-term plans and solutions that will lead them to be more self-sufficient and economically independent, to break that cycle so they're not so dependent on our services and programs. And ultimately, that's what we want. And that really is in two key areas that we work on, and that's education and employment. Next slide. This just gives you an idea of some of the programs and services that we provide. Really, the main program that we are providing is case management services. So that's why you see that concept that we are your bridge, because when we looked at our mission statement, we said, well, what are we really here for? And we are here to assess clients' needs, but then to link them with the appropriate community agencies and programs in order to help them. So what we really are here is as a case management function. We do have some, we're lucky enough that the town supports us with some funding for community, what we call community partnership grants, where we have small amounts of funding that we provide to community agencies that directly assist our clients. That's aligned with our strategic needs, really around basic needs. So you see basic needs counseling. There's a lot of mental health support that we provide. A lot of our clients have mental illness. Housing issues, obviously. Energy assistance. And again, education support and employment support are really two key areas that we work with clients on in order for them to resolve the long-term issues that they're dealing with. And we also have a homemaker service. So we have some staff that go out and are providing light housekeeping, meal preparation, laundry. So, you know, I think every social service department is unique, and this is what we provide. Each social service department is different, but that also will dictate what your data needs are. Next slide. So here, this leads us to tip number one, which is to find the right program fit for you. And again, this is extremely important, and you have to take a look at the size of your organization, the complexity of your organization, and what are your data needs. Can it be met by an Excel spreadsheet, or is it to the degree where you need a more sophisticated management information system? So you really have to take a look at your organization and find the right size fit that will help you with meeting your data needs. The other thing, when you're looking at software systems, as what we were doing a number of years ago, we were looking at some products that marketed themselves for multi-service organizations. That's not what we wanted. we needed a product that serves the case management organization and its clients. So that's what was very important for us. Next slide. So we had a problem. We had a software system that we were operating with for close to 13 years. And over those 13 years, we were finding it very difficult to operate. The feedback that I was getting from staff dangerous word. It's a red flag. It means that it's not working properly for them. It's too slow. It's too difficult to operate. It's not. They'll say it's not user friendly. They have to keep entering the same data over and over and over again. That's when you know either you need to work with the existing system to fix it or to move on. So our staff considered the system something that was not helping them. It was something that they had to do. They had to put this information in, but they were not seeing the software system as an essential tool for them. And I would hear, well, do you want us to work with the client or do you want us to treat the chart? Which one do you want? And of course, as administrator, you want both. But if there's a conflict over their time and time management, whether they're going to be spending all their time doing documentation or attempting to do it, or working with the client, that's when you know that it's not balanced. It's not being equal, and you have to do something about it. And also, a lot of the data that was being entered, we couldn't rely upon. So next slide. So we had to make a decision. So what we needed to do was to review the system, and that's what we did. We were lucky to find consultants that had both expertise in social service agencies, which was important to understand what we do in our environment, but also understood the needs of software. So they had areas of expertise in both, which is what we needed. So they, this was 2 summers ago, came to our program, and they made a complete review of our system. And what was included in that, you'll see, was our system program design. So in essence, what they were looking at was our functionality of the system. So they looked at, over time, the configuration became more complicated, it became more restrictive, it was difficult to navigate, it was a lot of redundant data. So this is what they were finding when they came here, and they were provided with a training session by one of our staff. So they were witnessing the same thing that our staff were observing and reporting back to us, what our staff was experiencing. Then there was also the support and maintenance. That was another problem that we had, a real challenge, because it was 3-tiered. We hired a department IT specialist, and he was responsible for maintaining the system and training the staff. We also had our town IT department that was in charge of the server. And we were also working with our vendor. They were responsible for supplying us with all the upgrades and the maintenance. So I had a real untenable situation on my hands where I was dealing with 3 different levels of complexity of trying to keep the system going. Not good. So that led to a lot of problems. They reviewed our staff competency, and what they really found was the staff were pretty competent. To some people's surprise, the staff really were doing their best to enter the data, but the program wasn't really working with them. Matter of fact, a lot of them were savvy enough at that point to know how to do the workarounds the system, because there were actually 2 or 3 different ways of getting information in. That's also a bad sign. So what they came back with, the consultants, was that staff were pretty competent, but the program wasn't working for them. So they identified strengths and weaknesses, and then their recommendation was to whether maintain the existing system or move on. And if you look at the next slide, our decision was to move on at that point. So for tip number 2, put your data to work. Your data has to work for you. You just can't compile reports. It has to be something that you're collecting to show what your outcomes are. That's been one of the main criticisms of our field, is that we're doing a lot of work. We say we're doing good work, but how are you showing that? How are you documenting that? Well, now we have tools such as ClientTrack. And again, when we went through our RFP, after the recommendations made by the consultants to move on, we went through a year-long RFP. We reviewed 5 systems, and we use for an ideal MIS system. So outcomes have to work for you. They have to provide you with the information that you can make decisions on, but also then can report back. Next slide. So again, where do you start? When you're working on your program, again, I go back to what my mission is. You know, what's the purpose of your organization? Next is, well, who are you serving? Who are your consumers? What are their needs? Again, that directly dictates what kind of data you need to be collecting. And also, next, what are your goals? That's your desired end. What are you trying to accomplish with your clients as they're presenting those needs to you? How will you achieve it? Well, that's through developing measurable objectives. And how will you know you succeeded? Well, by the results, which are finally provided once you put all of that information together, which are the client's needs, what goals you've established with them, the objectives, the time frames, and then to review the results. And again, I'll just say all of that is built into your service plan. Next. Well, now it's time for the poll.
Yes, hang on just a second. Thank you so much, Dr. Berry. This is fantastic. We're going to do a quick poll, and I will read the poll and the questions. If you'll take just a second to answer, we will provide Dr. Berry and so we just trying to get a pulse, you know, that you currently don't collect your metrics, or you collect them but you don't do a lot with them, which is pretty common with some organizations. We collect metrics, but we want to improve how we use them, or we review metrics and use them to determine our strategy, that you really use that data that you collect and it helps determine your strategy. Okay, so please select one of those, and again, we will give the results to Dr. Berry, and he will announce them shortly. Thanks, Dr. Berry. Back to you.
Okay. So next screen. Okay, so what's next? What actions can you take to achieve your goals? Number one is you have to have staff input and involvement in the design of the program. You have to have a shared vision. We involve staff from the very beginning. It's challenging at times, but it's worth it. You have to have that input. You can't be doing it on your own. They have to be involved. They have to have an investment, a sense of ownership in it. Again, you also have to have an understanding or agreement on what your desired outcomes or goals are. And I'll go into that a little more in detail. But again, shared vision, shared goals. You have to identify what's the most important data to track related to meeting the client goals. The solution that best fits the operational data flow, I would highly recommend that before you go into this, you work out a flow chart for your organization. In other words, follow a client from the phone call or knock on the door all the way through the process of discharge. From that, you can identify where the critical junctures are for data collection and where you need to be collecting it and what needs to move on. I think as I mentioned before, that's translating the needs that are coming into your organization, probably through your intake area or evaluation area, that's moved on to your direct service area. And that's where you're taking the needs and then translating that into working with the client on how do you go about establishing goals, objectives, and not just objectives for yourself, but what is the client responsible for? It's a two-way street. And then you go about monitoring the progress of that through your case notes, looking at the time frame for that, and then ultimately, what's the status? Were you able to achieve those goals? The other part is staff training. It has to be ongoing. What you'll find, and you probably know in many ways, is that staff have different skill sets, abilities to work on these systems. Some take it to it like a duck to water very quickly, and others need a lot more work. So you have to have an ongoing training program, especially if you're making any kind of future changes. You need to bring that back, put it through your training module, making sure that it works before you move on to production, and having the staff work on it. So again, the staff training has to be ongoing. Next. So tip number 3 is to resist knee-jerk reactions. So as you put the system in place, the software system in place, there will be recommendations by staff to make changes pretty quickly. They start taking a look at the program. They immediately see things that they want changed or revised. And what I would recommend is that if you can, is to avoid that, to hold off on that. Learn the program. Become more knowledgeable about the program, comfortable with the program. Bring together all of those changes that are being recommended, keep it in a parking lot somewhere, and then once you feel that you have some expertise over it, that staff are feeling comfortable with it, you'll begin to see what changes make sense. So what I would avoid, again, is that first knee-jerk reaction to make changes within the system, and use it the way that it is. And then later on, once you have a better feel for it, start to make those changes. Next slide. So again, what metrics should be serving as indicators for your progress in achieving your goals? So I just put this out in terms of what we're looking at within our organization. So, are you collecting these metrics? Are you using them, or are they just falling into a black hole somewhere? What we've done is we've established some interventions that we want to measure to see if we're making some successful outcomes or results with our clients. So just simply, if somebody is coming in with an eviction notice, were we able to avert that eviction? So that would come under one of our significant strategic needs for housing. Was there timely medical services provided? That would come under health care. Was the client able to find a job? We're working now with a community agency that comes to our agency twice a week to provide job counseling. So we're working with them in a collaborative sense, but is that leading to employment for our clients? Also, family counseling for personal safety. If there's some domestic violence, were we able to provide family counseling? So we would be able to incorporate all of that into our service plan, monitor it, and then see, are we achieving those goals with our clients in an overall sense? And then we can be providing that kind of information to my board, because I report to a 7-member board, or to the town committees that help fund my department. So, and also to establish those in the ways of dashboards that staff can now view, which is one of the advantages of ClientTrack, is that they've got the client dashboards. So you can begin to establish these kinds of reports and have them as a dashboard. Next. So tip number 4, as I mentioned before, is to cultivate your garden in a way to provide support and maintenance. You've got to have clean data. I'll just give you an example. As we're implementing ClientTrack, we're migrating a lot of our information from our old software system to ClientTrack. And when we pulled out the total number of names, clients that we have in our system, we came up with 1,100 pages. That's close to 14 years of data collection that was not cleaned up. So now we're having to go through all of those names, because many of them are duplicates or triplicates. People put in a name, they don't spell it correctly, or there's a new name and they don't go back and change it, they just put it in again. It's things like that that you put into your system, and over time it really clogs it up. And so you really have to make sure that you're weeding and feeding your system, that you're making sure that the data that you're putting in is clean so that the data that you get out is effective. So it's really important to work on that. And what we've done here to simplify it is we've now contracted with ClientTrack for cloud-based technology. So we've now eliminated one layer that I mentioned before. The town no longer is in charge of our server. That's now part of the cloud-based technology with ClientTrack. And we've also contracted with ClientTrack for their information service, continual improvement service, CIS. So that means that any future changes or any kind of configuration changes we want to make within the system, we'll work with ClientTrack on that. So everything now is fully integrated. We no longer have the staff member working as in IT in our department. We no longer have the town. So everything now is being incorporated and integrated with one partner, being ClientTrack. So we consider that to be system put into place so that we're constantly going back and looking at our data to make sure that we don't get into the same situation. Any sort of changes for the results. So what we have is so we have a number of reports that we've established. What we like about ClientTrack is there are a number of canned reports, but you can also make custom-made reports right through the system, which is terrific. But you've got to have the staff review and feedback concerning those reports. Service plan updates. Staff should be updating their service plans as needed, or at least on a quarterly basis. And you're reviewing them as supervisors, reviewing those service plans with the staff to really determine whether the staff member is using the system properly. Are they using all of the assessments that are available to them? Are they working on their goals and objectives in a way that's leading to results or outcomes? Getting that kind of feedback through the service plan. And again, the more they work on it, the more they become data savvy staff, which is what you want, because that's when they can really come in and start making some really good recommendations on how the system can work better. And it does happen. And again, you have to have consensus on goal setting. If I have a goal that I think is important for the organization, but the rest of the staff doesn't think that way, it's not going to work. So you have to have consensus on your goal setting. Next slide. So tip number 5, again, create your service plans. That's really the main area for you to be providing all of that information. It's your repository for providing your very important information concerning your clients. So again, you're translating all of those needs into the client's goals or objectives, what you'll be working on, what the client will be working on, and just making sure that it's progressing, it's going in the right direction, and if not, what needs to be revised. So then, again, it's a win-win for the organization, for you, and also for the client. Next slide. So again, just to go over these tips in summary, find the right program fit. That means right-sizing the program to your organization. 2 is putting your data to work. That's choosing the right metrics that will show the results that you want to see. 3 is to resist knee-jerk changes, which is to master the program before you start making changes. 4 is providing support and maintenance. That's ongoing cleanup and support. And lastly, create service plans that consider data. And again, that's the heart of your data storage. So those would be the 5 tips. And I think if you go to the next screen, we show what again, when we were going through our RFP process, this is what we established as what we would think to be our ideal MIS. So it helped guide us. when we were reviewing the RFPs, and this is what ClientTrack came pretty close to meeting all of these criteria, which is why we chose ClientTrack. And that's my presentation. Do we want to look at the poll at this point?
We absolutely do.
Okay.
Thank you. So we'll just bring those poll results up. And so we can see that of the people who responded to our poll, who are with us today online, about 4% do not currently collect metrics, 15% collect them but don't do a lot with them, 57%, so the majority, collect the metrics but want to improve how to use them, which is obviously why they joined us today, and 23%, which is a pretty big percentage, are reviewing those metrics and using them to determine the strategy. Obviously, there's always room for improvement, but that's a pretty encouraging number, and so I would congratulate those of you who are already collecting and then using that data to better determine your strategy moving forward. Thank you, Dr. Berry. That was a fantastic presentation. And now what we will do is to turn this time over to Carole, and she'll show you a little bit more specifically about ClientTrack and how this particular client, as well as others, can use ClientTrack to manage the data within their own organizations. Carole?
Perfect. Thank you, Amy. I'm really thrilled to be able to get the opportunity to share this information with you today and showing you our ClientTrack 15 interface. For those of you who have attended previously, you may not have seen this updated interface, and so it's exciting to have the opportunity to share that with you as well. I'm sure many of you are aware that ClientTrack is a web-based platform, and as Dr. Berry said, that was something that was important because when you have organizations and different locations, providers that are set up in different areas, having that kind of web-based access is really important. And also this, us hosting, so ClientTrack hosting that particular environment provided some great security and took care of all that network side of things that can sometimes be a little bit overwhelming for an organization. But to access ClientTrack, all we do is we type in a web address, so you can open up any web browser, whether that's Firefox, Chrome, Internet Explorer, that kind of thing. Type in a URL, and then you'll be presented with a login screen. And once you log in, it is going to ask you some information, and I'm going to just give you some basic information about what this means: workgroup, organization, location. One of the things that makes ClientTrack very easy for the end users to pick up is this concept of a work group, and this work group is where we can determine which menu options are going to be visible to the end user. So think about it. If you are somebody who is doing intakes, for example, you probably have different functionality that you'll use inside of ClientTrack than somebody who is doing case notes and maybe doing interactions with an individual. We also have a robust security model, and we handle that with organizations and work groups. So we work with you to see how you can how you want to share that information, and we share with you our best practices from many years of experience doing the same thing. So I click Use These Settings. And once I'm here inside of the application, there's some navigation over on the left. We have different workspaces that you'll see up here, and with ClientTrack, as you can see, these little call-outs that are showing up, these are help that is built right into this. So if I click on Home, I can see that there are different work groups. I have a home work group, a client work group, provider work group, so I can keep track of referrals in and out of the system with different providers, and then keep track of those outcomes, that referral outcome. Did we make the referral? Were they turned away? Did they receive the service? Did they no-show or cancel? So we provide a provider workspace that can be utilized for that. Also, as part of this, we have housing, so just to show you some examples. So we can also have facility management available through ClientTrack. I want to show you a couple of things that Dr. Berry was speaking about in our client workspace. One thing that he mentioned was a concept of a dashboard, and a dashboard is something that gives you, in the client workspace, a client at a glance. and it's going to show you information like demographic information at the top, different program enrollments, services that this individual may have received. Also, it gives you information about other members of their family. So if you are an organization that works with families, setting family goals, we can quickly jump from one person to another by just clicking on that family icon and then moving over, and we could do case notes or record services for them. So quick family navigation. Also on the left are some menu options, and some of the menu options that I want to make sure and point out to you are goals related. So Dr. Berry was talking about service plans and the importance of making the right service plan and tailoring your service plan based on the metrics that you want to gather. What is the information that you need to track for them? And what are the goals that you are setting for those particular clients? In ClientTrack, we have some goals functionality that's going to show you any goals that that individual may have been working on, and it also allows you to add some new goals. Now, when you're creating goals, there are some big goals. Maybe there's some community involvement goal, and maybe it's a long-term goal, and we're going to say, you know, volunteer at the food pantry, and it's a long-term goal. That's something they want to do long-term. We can associate it with an enrollment in a program, and we can also set a target date for that. So if that's something that I wanted to have and for a year to participate at the food pantry and spend that time, I can set that target date for a year out by just selecting that. But what's also nice about the goal here is that we not only identify what that goal is, the goal, there are many action steps that may be required to accomplish that goal. And an action step, for example, might be to complete the volunteer application. They need to complete that application, and then what is the target date for that particular goal? What's nice about this also is that it is assigned to me as the case manager for this individual, so I can follow up with James and say, okay, how are we doing? We've got this goal that's coming up. How are we doing on that goal? And then we can put all of the different steps that may be required to meet that goal. So if the next thing is to fill out a background check, and we can set the dates for those as well. So all those individual steps that are part of a goal can be tracked through here as well. And that can be something that is put into your service plan, whatever the goal may be, that we can follow up with them appropriately. So when I set this goal and I have that for James, this is something that's going to appear in his goals, in his historical goals. Once here, we can make notes that are related to that goal. We can look at specific goal progress. We can record services that were provided to support him in reaching that particular goal. One thing that's also nice is that with ClientTrack 15, if this is something that you're going to be doing on a regular basis with your clients, then there is a star up here in the upper left that says add to favorites. So each user can create their own favorites over here on the left. So if I click add to favorites and I have goals there, I can click save, and now that is something that is available just with one click. So that's something that those end users will really appreciate, is the opportunity to create their own favorites, not just be stuck with the ones that have been decided for them. Some other things that are very nice about this services and different programs that really kind of sets things apart when looking at different vendors is that we have this eligibility. So we can look at eligibility when it's related to referrals. So if I'm looking to find out what kind of services somebody may be eligible for, there are different eligibility criteria, and you can see over on the right side how we have that eligibility criteria that's being evaluated and then letting us know if we can create a referral for a particular service. And then once that's determined, I can come over here and click on Create a Referral, and that will allow me to refer them to an organization. Filled in that referral service, I can click on the search, and it's only going to show me those providers who offer that particular service. So I can find that information and then record the status of that referral for this individual. In addition, with referrals, if there's a voucher that is necessary, we can fill in the information for that, and we can even send an email to the provider letting them know that we created that referral and that this particular client should be reaching out to them. It also allows them to be more proactive and contact the client and find out if how they can provide the service or even set up an appointment. If you do set up an appointment with somebody, I can simply come to the date acknowledged. I spoke on the phone with somebody today, set up an appointment for Thursday at 10 o'clock in the morning, and then we can identify when they've received that service, that result. What was the result? Did they provide the service, just provide them with information, etc. So that eligibility criteria and then referrals allows you to really access and take advantage of those community resources that exist that can really provide the services that are important for an individual. So those, again, referrals can be eligibility can be associated with referrals, with different program enrollments, with funding sources. So if you've got funding sources that require specific eligibility, and then also for services. Now, Dr. Berry's talked about the importance of being able to report on the information, right? To be able, because it's one thing to gather the information, but if you can't report on that, it's difficult to find out, are we really making a difference for some folks? So with ClientTrack in our home workspace, this is where we get a picture of kind of what is going on for overall inside of this organization. And we have a number of different reports that are available to organizations. Because we've been in the business for a very long time, we realize that there are certain reports that are necessary and desired most of the time, and we include this as part of our software, is all of these reports that can allow you to go in and look at client goals, goal outcomes, for example, and even employment status, employment improvement. So these kinds of things that are interesting to know. So if you're doing a service plan, for example, a goal outcome type of thing is where you can go in and run, we call this a push button report, this goal outcome report. You simply select different criteria for date ranges, and then you say, well, what do we want to do? We want to find out if the target date was in that date range, and then we can filter by organizations, by different programs, by different goal groups, for example. And we can run this report right now and have that information available to us. But one thing that is very appreciated by managers, directors, is this ability to schedule a report. When you schedule a report, it is going to ask you how often you want to run that particular report. You can run it just one time. You can run it every day or every 3 days, every 5 days, however often you like, even weekly or monthly. When you set this up, you can determine what date does it start, what is the day of the week when that report will run, that desired hour. So if you want to do it in the evening, after you've done a bed check or something like that, you can do that. and then also what format you want that report to be exported in. So it could be an Excel, a Word, or a PDF document. Then once you've selected those criteria, you click Schedule this report. And automatically every week, in this particular example, it is going to send me an email and let me know that that report is ready. It then will provide me with a link that I can use to log into ClientTrack and view the results of that report. So that kind of maintenance that goes on with kind of always staying on top of that data that Dr. Berry was talking about, that kind of maintenance is really helped by being able to look at your data on a regular basis. And whether this is different clients in programs, making sure that what's happening in the real world is what you also have in your database, and also different things for services. What are the services that we provide, and what are the different how much those cost, you know, getting service kind of summary reports. So we include a lot of service types of reports as part of the regular ClientTrack package. So you can run a report, and this particular report is going to show us kind of some of those goal outcomes. All of our reports can be exported to a different type of format. You'll see that also this particular report is set up so you can drill down into that report. So if you are looking at child advocacy goals and you want to see more information about that, you can drill down into that particular report and find out more information. Let me find over here in counseling. So this is a program, so it's a counseling program, and then it's going to show the different things underneath that counseling program that where you can actually drill down into that. So by just clicking that plus, or you can just export the information directly. So I can say expand all and say that yes and pull that information out into a different format. So I can pull that out into Excel and have that information available to me as well. So some great reports that are built right into ClientTrack. And I want to make sure that I also mention that we have another reporting tool. I want to make sure and get to that. But now you can see the breakout here. Is the goal opened? Was the goal achieved? And for goals that were achieved, was it achieved within that goal target date? So good information there for goals and tracking those particular goals. We also have referral reports where we can keep track of different referrals to providers, services that were provided, doing those services by providers, or a service summary, or demographics types of reports. But one of the things that I think you'll hear the most about ClientTrack that people comment on is our Data Explorer tool. In Data Explorer, you have the ability to create your own queries, and you don't have to have programming knowledge to be able to do that. So I'm going to bring up a query that I've created and just show you how that works. So this one is closed goals with services. It allows you client domain that's going to have more of your information about, you know, a name of a person, you know, their gender, those kinds of things that are related to them, and then also services. Goals in that goal group, and then the number of services that were provided as part of that. Also with the Data Explorer tool, you can limit the records that you're going to view here by setting filters, and these filters allow you to select different criteria. And this one is saying we want to only look at those where the status of the goal is closed. So then if I click Show Me down in the bottom right, this gives me the ability to come and look at this information. I can even create charts that go along with that, so I can look at the individual goal groups and see that there were 2 that were discontinued and 13 that were attained here, and so I can see, you know, how are we doing on that? Are we attaining most of those goals, or are we discontinuing some of those? So that information is there. Also the information for the results and those different goal groups. How many clients set goals in that group, and how many services did we provide to support them in those goals. This can also be exported out. The image can be made available and used on your website or as part of a presentation to start to show a visual picture of what you are accomplishing as an organization. I believe there was a question.
Yes, thank you so much, Carole. That was fantastic. So we do have a few questions that came in. The first question I'm going to address is for Dr. Berry. Could you please share with us what information informed your decision to remove your local IT staff and have ClientTrack serve as IT support for the system?
Yeah, that was really a decision that was made over time. You know, you can get very lucky and find somebody, identify someone. I think you're probably talking about the person that we hired within our department. What we found over time is that when we were trying to make changes within the system, it ended up we were putting little fixes into the system that in the end were not helping. Matter of fact, they were hindering. We were gerrymandering the system. We were kind of putting little band-aids in, and it wasn't really helping. And at that point in time, we also were not getting much in the way of support from the vendor. So by not having that kind of commitment, we were depending more on our IT person. And what we really found in the end is that it took a lot more expertise than what that person had in order to maintain the system, which is why we decided when we had the opportunity we saw that ClientTrack had this continuing improvement services section that it really provided us with a tremendous opportunity to work directly with them. And in that way, we can identify what configurations we want to change, but also they have the expertise to make those kinds of changes, and also to let us know, by the way, if you make those kinds of changes, these other things might happen. And that was part of the issue that we didn't have internally. So that was really one of the significant reasons why we moved over to having ClientTrack take that over.
Great, thank you so much. Carole, this next question is for you. We have someone who asked, are you aware of any organizations using ClientTrack with geographic information systems?
Yes, we actually do have a number of organizations who are doing that. We have a couple, as part of our services, we have the ability to capture geographic information when recording services. So if I come in and I click service and add a new service, one thing is that ClientTrack, you'll see there's a pop-up here in the upper left saying, would you like to share your location with ClientTrack? If I share that location, this enables me to actually pull in the geolocation for this and show a map for that. So it's something where we can capture the location, the exact location of where those services are being provided. This is a great one for organizations that are doing outreach and they're using mobile devices, because ClientTrack's mobile interface is something that can be utilized on a tablet, on a smartphone, and for those kinds of things when you are out and doing your outreach services. So that's one way that we incorporate GIS here as well. We've also been able to utilize an interface with one of the mapping organizations where we needed to determine whether or not somebody was within the city limits. We're seeing this come up more and more, and so what we do is if we have that polygon data, we can send that information to MapQuest, and interface with MapQuest to determine whether or not somebody is within a boundary based on an address that is there. So there's address verification that takes place where we can determine whether something is a valid address. It has the accurate zip code, and also the ability to map that address and determine whether or not it is within those city limits if we have that polygon data. So lots of great applications for GIS.
Great, thank you so much, Carole. Another question, Dr. Berry, for you. Could you please tell us how you selected the 5 case management companies you considered when you were doing your RFP?
Yes, well, we had a pretty extensive RFP, and I mentioned before in that last slide, we had established criteria that we wanted to see in an ideal system. So we used that, but obviously it was much more detailed in how we reviewed each of the 5 that we chose. There were more, but we chose 5 that came in to present. So again, you'll see it on your screen now, the ideal MIS. So we had that with a lot more detail with each one of those areas. And as those applications, those RFPs came through, we reviewed them on paper, and then we had each one of them come in to present. It was 2.5 hours, I believe, for each presentation, which in the beginning we thought was a little long, wasn't long enough. It's interesting. Once you begin to look at the presentations, you want to know more and more, and 2.5 hours, believe it or not, isn't enough time. But that's what we had, so we reviewed that, then we had follow-up questions after those presentations. We received the follow-up answers from each of the vendors. That was then reviewed by the committee that was responsible for choosing the system. We went through all of that. Each one of them ranked and rated each of the RFPs, and then we came out with the decision on which one. And again, that was obviously ClientTrack, which met
so much. We're going to go ahead and wrap up today's event. Again, thank you very much, Dr. Berry, for joining us and for sharing the wealth of information that you've shared today about the process that you went through. It sounds like it was an extreme from the experience that you had during that time. Carole, again, appreciate you joining us as well and sharing with us some of the specific information that's existing within ClientTrack. For those of you who have joined today's call, here's the contact information. If you wanted to follow up with anybody following today's presentation, you can contact Dr. Berry. He has graciously allowed people to contact him directly, prefer email, and there's his email address on the screen. If you do have any questions for us here at ClientTrack, you can either email us at sales@clienttrack.com, or you can go online to our website and enter your information there. We'll be happy to reach out to you as soon as possible. Thank you again for joining today's webinar. And if you have any additional information you'd like to put out on Twitter, again, you can go on #DataGap when you tweet, and we will follow up with you there. Have a wonderful day.